It says we're live. Hello, hello. It's Tuesday. It's 4 o'clock Pacific, 5 o'clock here in Costa Rica, 7 o'clock on the East Coast, midnight in Dublin, 1 a.m. in London and most of Europe, 8:30 and 9:30 a.m. Wednesday morning in Australia, and 11:30 a.m. in New Zealand. I hope I've got that right. And it's Facebook Live. And we've got our special guests. First and most important is Gio, here for a few minutes.
Hey, buddy.
Yes.
And Marthy.
And then, of course, Marzi and Michelle. So we've got quite the trio is three. What's the word for four? A quartet. A quartet. We've got a quartet.
And I could just spend the whole time making googly eyes at Gio and doing peekaboo. Hey, cute boy.
Yeah,
Are you so serious? Where's the smiles? You were just giving us smiles.
Yes, yes. Yeah, Daddy's voice goes up a little bit. And yes. So, hello, everyone. Welcome. Thanks for coming. And this is our monthly session with Michelle Ross and I on Q&As and your questions. And we thought that we would start by having a little discussion and roll into questions, but have a little discussion about anxiety, because so many people are facing that right now. Michelle, do you want to start with that one?
Yes, because it's every day when I'm talking to people, they're asking for tips and tricks for it. And I really think that no one has made it out of the last...
Yes.
Bye, Marcy. So good to see you. No one's made it out of the last year and a half, coming up on 2 years, without feeling anxiety and overwhelm and incredible stress, right? And so I find that the vast majority of people that I work with, a huge part of their illness is stress. Right? I don't know, it could be 50%, it could be 90%. But then if I'm, say it's 90%, and then I'm coming in for that 10% that's not stress related and saying, you need to take these supplements and you need to prioritize your sleep and you need to move your beautiful, fabulous body. And now I've created 100% stress, right? Because we've added in all this list of to-dos that are really beautiful at enhancing health and quality of life, but they can also, it can be stressful to make those lifestyle changes. So prioritizing, managing stress, of changing our mindset to create this healing mindset is so profound.
It is. You're absolutely right. And the key words, I think, for me and what you just said was changing your mindset. And I think that a tool in helping us in changing our mindset is to accept that this is going to take some time. You know, you don't change lifestyle overnight. And the whole concept of 1 hour a week that we've talked about so many times and will continue to talk about, where you just allocate a little bit of time every week to address one lifestyle habit or one eating style, whatever it is. But every week, just an hour, because nobody has a lot of free time to be focusing on changing these basic ways that we live life. So you spend an hour 1 week and you order new glass containers for the kitchen. So you throw away the plastic storage containers for your food. And because you've learned that you're poisoning your family with micro amounts of phthalates, these chemicals used to mold plastic, that get absorbed in the food that's stored in these plastic containers. But it takes you an hour to order glass containers, you know, and pay with your credit card and all of that, but you're done for the week. And the next week, it's one more thing. I think that you're absolutely right that I think we're all dealing with levels of anxiety that we've never had before because of what's happening in the world around us. And we need a game plan as to how to deal with that anxiety. And the first step in that game plan for me is for people to accept that it's going to take a while to learn how to adapt to a new lifestyle. And so be patient and kind to yourself. I want to do some shout outs to begin with now. Marzi got me on here on my phone so I can see who's here. And the first is Jane, who says, what a cutie. And Beth says, hi, I'm hoping to get some guidance for my 36-year-old daughter who is being diagnosed with subacute hyperthyroidism based on TSH at 0.451 down from 0.593 in February. That's a little low on the TSH, which means likely that the thyroid's working a little bit of overtime. Normal T3 and T4. We're very interested in working with your team to help correct this without surgery or medications. Oh, absolutely, without surgery and medications. Do you recommend she start with the radioactive iodine test that her endocrinologist wants to do? Or perhaps delay that and start with your team, or do both? Michelle, how would you answer that?
I would say delay it because I think that I know that the human body has an amazing capacity to heal. And so many of these thyroid imbalances are just that, they're imbalances, right? And so assisting in bringing the thyroid into balance is something that absolutely can be done.
Yes, yes.
And antibody testing, is it Graves? Are there antibodies? There's so many things that we need to know.
Right, there's more information needed before you can make a decision like that. Because when you use radioactive iodine, it has an impact on your thyroid. And it's not a first level diagnostic tool. It's more of towards the end of the line of things. And this guy's an endocrinologist, so it's understandable why they might go there right away. But there's so much that needs to be looked at first before you make a decision like that. And that your daughter's 36, you know, she's young enough to recover from this. It's a little more difficult when you're dealing with a 70-year-old with this kind of or a 70-year young, I should say. I've got to get that in my mind. 70 is not old. You know?
Right.
Oh God, I've got
change your mindset, Dr. Tom. Change your mindset.
one hour a week, change the mindset. Change the mindset. So thank you for that question, Beth, and absolutely have a consultation with our team first. Connie's here from North Carolina. I always love seeing your little boy, Dr. Tom. He's so cute. Thank you. Gwen's here from Auckland, New Zealand, and it's noon. Thanks, Gwen. I'm going to get that right yet. So it's noon right now on Wednesday in New Zealand. And she says, hi, Gio. Helen says, what a handsome baby boy. Thank you. Homa says, oh my God, he's so cute. And, you know, we get that all the time. And we're very grateful. And Marzi and I have worked really hard for close to 5 years, I'd say just over 4 years, for a help to prepare her body for a healthy pregnancy, healthy delivery, healthy baby. And that's my next book, you know, that I'm starting to work on now, is this whole process, because we need an army of little geos, meaning operating at the top of the scale. We just had his 10-month exam from the pediatrician a couple of days ago, and his jaw dropped again. He said, your son is in the middle of the pack for an 18-month-old, not 10-month-old. And his neurological reflexes, the doctor was startled to see what Gio can do in picking things up. And he watched him crawl, and it's a perfect cross crawl. There's no transition from the right arm, right leg, left arm, left leg to crossing. I mean, he's cross crawling immediately, which just means his brain and his nervous system are working really well. And so Marzi and I have worked really hard to prepare for this. And we appreciate the comments, you know, and everybody that sees Gio says, oh my God, because he looks in your eyes. You know, now I had him here a couple of minutes ago and my voice goes up a little bit because now I have to make sure that, you know, the microphone picks me up. And so he's sitting in my arms going, Dad, what's going on here? This is not the same energy, you know. But he's a beautiful little boy. Thank you for your comments on that. And that is what we need to do for ourselves, is to create the environment for a healthy body. And that takes time and patience. And so be kind to yourselves in this process. Dorada says, hello from New York City. Hi, Gio. Maggie says, hi from Cleveland. Becky says, hi, Gio. Jane says, hello from Michigan. It snowed here today. Oh my God. You know, Jane, I grew up in Detroit and we used to shovel 3 times a week from Thanksgiving to Easter when I was a kid. I'm no exaggeration. So it's back to the old days in Michigan where it's snowing on the 1st of November. My goodness. Yes. Maggie says, I've discovered it's possible to be stressed without even realizing it. Amen to that. That's right. You know, that these things get to us inside, and on the surface, we have the I'm fine syndrome. I'm fine. I'm just fine. But underneath, all these different things can be going on, huh?
Mm-hmm. So often people will say that, you know, they're like, but I don't have any stress. And I think that's switched a little bit, because I don't think anyone came out of the last year and a half without feeling some level of stress. But that's huge, Maggie, that you realize it, right? Because I think that's a huge step in the journey of healing it, is to even acknowledge it.
You know, 90% of the problem is solved when you recognize the problem, right? It's when we can't see it that we're stuck. Mm-hmm. Brenda says, good evening from Kentucky. Brandy's in Baton Rouge, Louisiana. Jill says, 3 weeks after I went on a low-fat WFPB diet. Now, wheat-free PB. What's
I think it's whole food plant-based. I just had to look it up. I just had to do a DuckDuckGo search.
Well, that's impressive. I was going to say peanut butter diet. So.
Wheat-free peanut butter diet.
Right. Well, congratulations on that, Jill. And how are you feeling? You're 3 weeks into it now. How is your body adapting? Give us a comment. Eric's watching. Lucia says, hello, Dr. Tom from Tucson. Kathleen's watching. Brandy asks, what is a breathing technique that you recommend to cope with anxiety and stress? Oh, I've got a really good one. My friend Pedram Shojai, Dr. Pedram Shojai, put this, he wrote a book about an exercise to do every day. And the first one for day one, this was 365 exercises, one for every day of the year. The first one was set your alarm for 1 hour from now and let it beep every hour. When it goes off, no matter what you're doing, just pause for a moment and take 5 deep breaths. So if I do that now, it would look like this. 1. 2. And you do that for 5 breaths and then just go on with your day. You know, if you're driving, you can do it easily enough. Just turn the music off. Or if you're sitting at your computer, just put your hands down and pause for a moment. Take 5 deep breaths and do it every hour. So you set your alarm to go off every hour, and it's like 15 seconds, maybe 20 seconds every hour. And notice how you feel towards the end of the day. Just by doing this simple exercise, it was startling to me to see how impactful it was just to take 5 deep breaths every waking hour. Well, I know we're supposed to meditate for at least 30 minutes or an hour, and I can't take that much time, and so I don't do any of it. 15 to 30 seconds once an hour. Try that and see how that feels. That would be my recommendation. Michelle, do you have another recommendation for that breathing technique?
I love heart math. So heart math is something that you can buy, the little attachment to clip that clips to your ear. I usually have it sitting here, but I don't see it right now. But you can do it for free. You just go to the stopwatch on your phone, and there's a lot of research on this, but basically it's a 5-second inhale, 5-second exhale. And so you just hit the stopwatch, inhale for 5 seconds, exhale for 5 seconds. So that you're slowing your breathing down to a 6 breaths per minute. And we are pretty much all hyperventilating our way through life. Like if you look at the breathing, if you have a, or a ring, or if, when you're done watching the Facebook Live, if you just count how many inhale exhales in a typical minute, most people are doing like 17, 16 to maybe 24. And we need to be doing 6. So we're not going to get down to 6 breaths a minute unless we practice it, right? So they recommend 5 minutes twice a day. I'm all about what's realistic. If we put that on ourselves, we won't even start. So go for a minute, right? Many people take their phones to the bathroom with them. You can sit there and breathe while you're doing your business. But, you know, if we could do it first thing in the morning, get daylight exposure. If you live in a cold climate, just open up a window. If you're able to go outside, if you live in Costa Rica and you can go outside and get that daylight exposure to turn off the melatonin, reset your circadian rhythm, and do some breathing, it can be a beautiful start to your day. And if you have the device, if you are not in coherence, that's the equivalent of meditating. That's the idea of this type of breathing, is to get into this meditative state. They'll tell you to breathe in and out through your heart and to smile. So if I don't have the device with me, then I usually do this cheese ball grin and I hold my hand over my heart to like focus on breathing. And then that can get you in that state of coherence and calm. But there's so many, there's box breathing. There's no one right or one wrong way to breathe. Breathing is just critically important.
Critically important. And you know, as Michelle was demonstrating, talking about putting a Cheshire cat smile on and putting her hand over her heart, there was a part of me that said, you know, and, you know, this is the guy that grew up in Detroit and rides Harleys. And that part of me said, well, I'm not going to do that. That's pretty vulnerable. No, but you're sitting there alone, right? You sit there alone in the privacy of wherever you are, your car or your home, and nobody's watching you, and just notice how you feel. And that's the key here. And if you have the Aura ring that Michelle's talking about, that's AURA, Aura ring. Or if you are monitoring your pulse rate or monitoring your respiration rate, you will see that things start to just calm down. And when things start to calm down, you produce more hormones for a calmed down person. They're called neurotransmitters. And you go closer to a state of relaxation as opposed to being keyed up with short breaths and multiple respirations per minute, many more than you should have. So these simple exercises, the one I gave you or the one Michelle gave you, it's a really good way to start in working with breathing, to notice what state of mind you are currently in and what state of body you are currently in. Are you keyed up physically, you know, short breath? I'm exaggerating, but as opposed to slower, deeper breaths. Lucia, go ahead.
There's a movie on YouTube. It's called What the Bleep Do We Know? It's an older movie, but it's really amazing. And they talk about how, you know, this is kind of a summary of it, but we have parking places on our cells for these different emotions. And if we're only feeling anxiety and stress, then we only have parking places for anxiety and stress. And we lose those parking places for joy and happiness. And that was such a good, when I watched that movie, I just thought, I want to create more parking places for the emotions that I want, right? And not only have these other parking places. There's another thing, Dr. Tom, that I'm sitting here that I wanted to bring up, because sometimes we need to use Band-Aids, right? One of my favorite Band-Aids to help with anxiety is something called L-theanine. Mm-hmm. And the type of L-theanine that you want to use is sun-theanine. And it's like a natural Xanax without the negative side effects. It's made from green tea. And it can be a beautiful supplement to take the edge off of that stress response. And sometimes taking that edge off can allow you to do the breathing, or to allow you to kind of get in the state where maybe you can do a meditation, or, you know, listen to a guided meditation, or move into those modes. Because if somebody's in such a heightened anxiety or stress response, it's hard to even transition into these things that can assist.
That's a really good point. You know, and there's another product. The one that I use is called Kava, Kava, Kava Light, and it's from Sunhorse Energy, sunhorseenergy.com. And we'll put a link in here for that for you, for Kava Light and for L-theanine. And Kava comes from the South Pacific, and the phrases in those cultures, the indigenous people of the South Pacific, is where there is Kava, there is no war. And so these islanders won't fight against each other if they're doing Kava regularly. So because it's so calming and so relaxing, it's not a psychedelic, it's not a drug, it's very legal. It's not like hemp or marijuana or any of those types of things. Very safe for everybody, pregnancy also. And you just take a little Kava and you just feel happier. The edge is taken off, just like with L-theanine. So you have a couple of options there that you can try. Lucia says, I did that 4 years ago, meaning glass containers. No more plastic at home. Way to go. Jill says, 3 weeks after I went on a WFPB diet, my triglycerides doubled from 70 to 140. Why would that happen? My total cholesterol went from 220 to 169. Well, depending on what food choices you were making there, a triglyceride of 70 is a little on the low end. It's okay, but it's a little lower side. But that your cholesterol drops so much is really a good sign, your total cholesterol. I wouldn't worry at all about that. If it continued to shift if your triglycerides continue to go up, then you would want to pursue that a little bit further. But when you're changing from one lifestyle to another, in terms of food selections, we think that, all right, I'm going to change today, or I'll change in the next 2 days. And then we expect our body to be able to adapt to these new foods, which are really good for you, but to turn over and adapt right away. An example of that doesn't happen is when you go gluten-free, which for many people is a smart thing to do. Not everyone, but most people, it's a smart thing to do. We always recommend you test to see if your immune system is fighting wheat. But when you go gluten-free, and people usually start feeling better, they lose weight, their energy goes up, they sleep better, whatever their symptom patterns were, they notice they're better. But what people don't know is that 78 to 81% of the prebiotics in the Western diet, those are the foods that feed the good bugs in your microbiome, the probiotics. So the prebiotics are the foods that feed the probiotics. 78 probiotics are the. Is that me?
No, that's me. I'm sorry.
Okay. 78 to 81% of the prebiotics in the Western diet are the arabinoxylans in wheat. That not everything in wheat is bad for you. There's some good things in wheat too. The problem is, for most people, the bad things outweigh the good things. But when you go on a gluten-free diet, you immediately stop feeding the good bacteria the food that it's been used to forever, for your forever. If you're 20 years old, for 20 years. If you're 60 years old, for 60 years. Your good bacteria in your gut has been depending on wheat, the arabinoxylans in wheat. And so now you go gluten-free and you start eating gluten-free blueberries and gluten-free bread and gluten-free pasta. And all of that stuff is just white paste, that it has no prebiotic value at all. So what happens over the course of the next number of months is that people's concentrations of the good bacteria start to die off. They're starving. They're really starving. And because you've replaced gluten-containing foods with gluten-free containing foods, which have no nutrient value whatsoever, and your good bacteria start dying off. That's why you need to follow our protocols of how do you build a healthy, strong microbiome when you go gluten-free. So that is a critical component of going gluten-free. And I tell you that as an example because now you're going into the WFPB diet, which is whole food plant-based diet. And as you're going into a whole food plant-based diet, that means you're taking out the grains, most or if not all of the grains, and you're taking out most of the meats that you were eating before. There's some variation for people, but they're usually going on all plants or mostly plants. It's not a bad idea, but not considering this topic of, I need to make sure I'm getting a lot of prebiotics. So a whole food plant-based diet can really have complications for you. So for this person whose triglycerides went from 70 to 140, your body's in transition and your cholesterol went down, your body's in transition. You have to give it a couple of months and make sure that you're doing a balanced transition. Now, you know, when people want to be vegetarian, this is usually teenagers or young college students that they want to go vegetarian, which, you know, I did for a while. Pretty funny story. My brother and I, we went vegetarian for a while, and we had just bought Honda 750s, this whole new kind of motorcycle that had 4 exhaust pipes, and it was the first one with an electric starter ever. You used to have to kickstart your motorcycles. And so we rode our Honda 750s from Ann Arbor, Michigan, out to California. We had a great trip, and we went to visit our uncle, our family in Vacaville, California. And our uncle was a colonel in the Air Force. And he's a colonel. And he was a guy that was involved in determining bombing missions in Vietnam. So, you know, he was a tough guy. And we pull up there and our hair is down to our waist and we're on these motorcycles, right? And we tell him we're vegetarian. So he says, okay, whatever. And so they had carrots on the table all day and celery for us. And then he barbecued 4 big, juicy steaks that night. And he and his wife had a steak. And he said, well, you know, there's a couple steaks on the grill. I guess we'll have them as leftovers. And so our plant-based diet went down the tubes that night, right? It didn't last too long, all the way across country and maybe a few weeks beforehand. But when you transition, you have to know that the transition is a transition and that you don't go from this to this overnight without guidance, right? So I wouldn't worry at all about a triglyceride that goes up to 140 and a cholesterol that drops to 169 very quickly when you've completely changed your diet. Give your body a little chance to get used to absorbing the nutrients out of the foods that you're now choosing. Michelle,
I did a water fast at a supervised fasting clinic, and they did testing weekly, and my triglycerides shot way up because my body was living off the fat. So any fat in my system was just dumped into my bloodstream, and then it came down nicely and balanced out. So exactly right, Dr. Tom, there can be shifts. So I would maybe check it again in 2 to 3 months. And I mean, I think between that 70 to 100 range is a sweet spot. And I think you'll see it shift unless you're eating a lot of processed carbohydrates, which it doesn't sound like on a whole food plant-based diet. There shouldn't be processed grains in that. Then I see that shoot triglycerides up like crazy.
Kat says hello from Kentucky. Michael McKellar's watching. Amal says hi from California. Melissa says hello from New York. Can you touch on PCOS? Yes, we can. Michelle, do you want to start with that one?
Insulin resistance all the way. You've got to test fasting insulin, hemoglobin A1C, fasting glucose, and change the diet. You've got to create a diet where blood sugar is balanced and you're not dumping insulin into the system. So this is eating probably ideally 3 solid meals a day, drinking only water in between, because every time we put anything in our mouth that's not water, it releases insulin. So chewing gum and mints, and, you know, people drink tea all day long, or it's just, sometimes we feel like we just need something in our mouth at all times, or fun flavored water. That's dumping insulin. So it's really shifting all of that and figuring out how much protein and fat and vegetables you need to keep that blood sugar stable, and you can turn it around. There's other parts involved. It's usually high testosterone, but insulin is the main thing with PCOS. Agreed,
agreed. There are a number of triggers that you might have to look at with PCOS, but there are some primaries, and what Michelle has described as a primary. That's basic 101, that you have to get that stable. And one of the tools to measuring, as Michelle said, your insulin level, your glucose level, there's a formula called the HOMA score, H-O-M-A. Because people with PCOS, they usually have what's called insulin resistance, that your cells are resistant to using insulin properly, which means your body has to make more. And so you're making too much insulin for the amount of sugar in the bloodstream. That's called insulin resistance. And you measure that by a HOMA score. And we'll post here what the formula is for that. It's not complicated, but
I'll share a screen. This is the one that I always use because it's a calculator that does all the work. I just put it in for the team. But you put in your fasting insulin, your fasting glucose, and then it will tell you healthy range is basically 1 or below. And that means you're insulin sensitive. And then as you creep up closer to 1.9, that's early insulin resistance, and above 2.9 is significant insulin resistance. So glad you brought this up, Dr. Tom. It's profound.
It's an easy monitor for you to do. Another tool that will be out soon, I'm not sure it's out yet. It was in beta a few months ago, and they had thousands of people doing it, but in beta. But I know they were launching soon. It's called Levels, L-E-V-E-L-S, Levels. And you go to levels.blog, I think, was one of their sites. But it's a patch that you wear that monitors your insulin level and your glucose level. And it sends a message to your phone. So you eat something and you see when you're eating that your blood sugar level is 88. Great, good blood sugar level. An hour later you check and your blood sugar is at 142. You say, what? Well, I don't feel any different, but that's your blood sugar level. And so what you ate has had that effect on your body. And the next time you eat, you're going to see whatever food you're eating, what the effect is on your body. And it's a real-time measure that you can use. We've used the HOMA score forever. It's simple, and it's great that it's online now, that you can just plug in the numbers. But monitor your insulin sensitivity, move more towards insulin sensitivity instead of insulin resistance, because that's a 101 with polycystic ovary syndrome, PCOS. It's a 101. And there's hormone imbalances, as Michelle said, testosterone or your progesterones and estrogens may be out of balance also, but you have to stabilize insulin for PCOS. Terry says, hi to the dream team from sunny San Diego. I returned recently from a week vacation with a gut so out of whack, I'm a mess. What can I do to restore? Elimination has settled down, but stomach is still very inflamed. 3-month wait to get a Sibo test. Ugh. Well, hope it, I was gonna say, I hope it was worth it. You know, when we're on vacation, sometimes we do things, oh, I really shouldn't have done that one. But Michelle, do you want to start with this?
Yeah, well, I mean, there's research that says that 1 day of eating junk food can completely change your microbiome. I mean, that's when you just sit with that for a second. How many of us have done that on vacation, right? I mean, think of all these people that do cruises. Do they even do cruises anymore after COVID? I don't know.
I don't know. You're right. I don't know.
But yeah, I mean, we've all done that before. And even like with Thanksgiving coming up, right? Is it really worth it to be in that coma afterwards? Or is it better to eat mindful and really enjoy the food that you choose to eat during that time? So I think that is just something to think about.
You bet. You bet. Agreed. And if your gut is inflamed, there are a number of things you can do. Castor oil packs are great. They really help dramatically. We'll put the link here to castor oil packs. Our good friend, Dr. Marisol, is the go-to gal for that. She's got great packs and organic oil. So we'll give you a link here for that one. And that's the first thing I would do. Gentle, easy, non-threatening. Next level would be a colonic if you've had a colonic before, or if you know of a good colonic therapist. And then of course, an anti-inflammatory diet. Stop throwing anything down there that can be inflammatory. Give it a break as much as you can.
And 3 months, I'm so curious to know why somebody has to wait 3 months for a Sibo test. I mean, I just find, Dr. Tom, I mean, I just had a friend tell me that they're having to redo their Sibo tests. They're so tricky. If you blow into those little vials wrong, it gets rejected. You have to do it over. And the sensitivity and specificity, or the accuracy of gut Sumer, and they have a really extensive Sibo panel. And I just go by this. I mean, if you have this methane producing bacteria that's elevated, that's likely methane dominant Sibo. I've seen side by side a breath test and this test, and then the rest of these are hydrogen producing, and it gives us enough information to know if this is a weak area. There's also at the beginning of the test, you kind of see like a summary of everything, and you see where you maybe are on Sibo, or maybe it's more irritable bowel or inflammatory bowel. It's a really comprehensive test that you don't have to wait 3 months for.
Yeah, agreed. And it's new science. It's a science that's been out now for about 8 years, I think. And so it's much newer. Most doctors haven't heard of this technology yet because the hospitals aren't using it because of politics. But Mayo Clinic talks about this technology and has nothing but great things to say, and refer to it as a new era in laboratory medicine. So I fully agree with Michelle. We don't do the breath tests anymore. You know, if someone does a breath test, okay, that's fine. But it's a valuable line of thinking to use, but there's more sensitive and comprehensive tests.
Yeah, they say it's about 50% sensitive and specific. That means it's going to fail about 50% of the people that it tests. So if you get a positive test, it's likely that you have Sibo. If you get a negative, you may still have Sibo.
Right. And that's the breath test she's talking about. That's 50%. Mm-hmm. Not the gut Sumer.
Not the gut Sumer.
Gwen says, recently found out my birth mother has been diagnosed with hypertrophic cardiomyopathy. Can you discuss the risk factors, please? Well, yeah, what that means is that her heart muscle is swelling and it's not working so well. Just Google gluten and hypertrophic cardiomyopathy. And you'll see there are studies that for some people, that is the manifestation of a gluten sensitivity. Their heart is the weak link in their chain. That's the first thing I check whenever we have a patient coming in with cardiomyopathy. I always check that first, because when I read the studies, and there were, I don't remember now if it's 3 or 4 or 5 studies, all from Mayo Clinic, case studies of people with cardiomyopathy. And when they tested them and found that they were sensitive to wheat or to gluten, put them on a gluten-free diet, they got better. They got better. And you see the charts of the percentage of improvement in ejection fraction, which means how much blood's getting pushed out of the heart with each beat. And cardiomyopathy, your heart's not working too well. It's swollen. It's just not working very well. And you see that they go from 18% ejection fraction to 38% or to 42%. in the course of 2 or 3 months, just on a gluten-free diet, because they've already tried other things that didn't work. So the question here, Gwen, is what's the trigger causing the inflammation? What are the triggers? I have to stop saying what's the trigger because people think it's one thing. There are multiple things. What are the triggers that have caused the pulling on the chain where your birth mother's weak link is her heart muscle? So the more inflammation pulling on the chain, the more taxing to the heart muscle. And now she's at the stage where the heart muscle's not working so well. And so what are the triggers? Where is the inflammation coming from? You always have to include primarily, where's the inflammation coming from? And you can Google bacteria and cardiomyopathy, and you'll see that bacterial infections can cause this. You can Google mold and cardiomyopathy, and you'll see that mold can cause this. You can Google anxiety and cardiomyopathy, and you'll see a couple of studies that anxiety can cause this, that stress can cause this. So there's no one trigger, there's a number of triggers you might want to look at.
Kat asks, I know this could be a lot of things, but what about tingling in the feet? Everyone says neuropathy, but what would you suggest to do about it?
Well, the first thing would be the nutrient zoomer. What's that test called?
The micronutrient?
The micronutrients, because you want to look at B vitamins. That commonly can be B12, folic acid insufficiency, causing numbness, especially if it's a senior, but also gluten. I mean, we've got those pictures. Michelle, if you talk for a minute, I'll see if I can pull up the pictures.
Okay.
Numbness and
so
tingling.
I would definitely do Wheat Zoomer and Neural Zoomer Plus, because Neural Zoomer Plus has a whole section on peripheral neuropathy. But these tests can be done through conventional medicine. So this is on our website. You can see these are all from LabCorp, right? So they can all be ordered through insurance. They not always will be, but I would check these key markers for blood sugar dysregulation, because it can be associated with blood sugar dysregulation. So they'll put the link here and you can come and reference this. Glucose, hemoglobin A1C, insulin. If they can add on C-peptide and glycomark, those are really like a really comprehensive look at blood sugar. And then homocysteine is key, folate, B12, methylmalonic acid. Those are really important for that profile. I would maybe start here, try to get your doctor to order it. And then in the meantime, be thinking about Wheat Zoomer and Neural Zoomer Plus. And if you can't order it through your doctor, these are available here. And it's, as you can see, it's $4,500 worth of tests. This is what your insurance would be charged. Comes with an hour interp where we completely deep dive it all. But even if somebody's insurance was to cover it 75%, Dr. Tom, they still would end up spending more money. And the beautiful thing about this is we look at the patterns. You cannot tell if somebody has a healthy thyroid by only looking at TSH. That's like the tip of the iceberg. You have to have this full panel to really understand if the thyroid is functioning optimally. And these markers are just foundational. I think everyone needs them once a year.
Agreed. All right, I'm going to share a screen now and show you. When I found this study years ago, I remember how excited I was because it was such a game changer to understand the dynamics of numbness and tingling. So this study is called small fiber neuropathy and neuronopathy, and this was associated with celiac disease. We now know that it's any wheat-related disorder where this can happen. And the peripheral neuropathy, the numbness and tingling, they had 8 patients with neuralgia. 3 of them had no GI symptoms whatsoever, but all 8 of them actually had celiac disease. And the kinds of symptoms they had: tingling in the left arm, the left leg more than the right leg, burning pain, tightness, feelings of coming out of the snow into the warmth, first in the left foot, then in the right foot, stabbing, tingling, pins and needles, itchiness, onset right foot, months later left foot, numbness and tingling, burning, right foot, then the left foot, numbness in the hands. You know, they all were different, but it was all numbness and tingling. And they did the larger tests looking for nerve damage, and the EMGs were normal. All patients had one side or another that was stronger than the other, and it would switch. It was asymmetrical, and the motor nerve tests were normal. Well, that's because the motor nerve tests are testing the big nerves that go down your legs and the big nerves that go down your arms. But what they found was that it was the epidermal nerve fiber density. And what that means is the number of nerves just underneath the skin. So here on the left side, box A is a normal. That's the nerves, the number of nerves that should be in that little piece of skin that they took. And then you see the flap on top is their surface skin. And right underneath it, that's where the nerves are. And then the one on the right, B, that's a celiac. So this is when other autoimmune diseases occur from gluten. And in this case, the immune system has been attacking the nerves. And you see that the epidermal, meaning just under the surface, nerve density with celiac disease was much less than a normal person. And that was causing their numbness and tingling. And what they found was that 50% of them got better on a gluten-free diet. And that's after they had been to neurologists and done a bunch of tests, and they couldn't find an answer to it. So I really like that one. And we now know it's not just celiac. So that means if you're suffering from that, I would do the wheat Zoomer right away, just right away. Michelle, anything you want to add to that one?
Absolutely. That was great. Love it when you show research. Okay, Shankio, I never know if I pronounce her name right, but I love that she's often here. She said thyroid was fine until she had urine testing that indicated iodine deficiency. So she started taking iodine, and then testing showed that her TSH was low. She wants to know if she should skip on the iodine now.
Well, if you did a urine test that showed an iodine deficiency, at some point you do a urine test that shows you have adequate iodine now. You know, if that's what it was based on, I assume you do that with the doctor. Say, all right, let's go back and check now. I've been taking iodine for a few weeks or whatever the time frame is. Are my levels normal, or should I continue taking it?
And maybe just adjusting the iodine. If you're taking thyroid meds, you may need to adjust the thyroid meds. So finding that sweet spot for thyroid can take multiple testing, right? As you're bringing it back to a healing spot.
Lucia says, I got my pendant for my whole family and I really improved my sleeping. Thanks so much for the advice. I love it. And that's great. She's talking about the Harmony bracelet, I assume. And we'll put a link in here to that because we were asked to talk a little about anxiety today. And the Harmony bracelets are just so great for that. There's testimonial after testimonial of people who have said, as a matter of fact, our Facebook Live a couple of weeks ago was on the Harmony bracelet. And I think that's what she's referring to, you know, that she got it after that. If you're feeling anxiety, if you're feeling keyed up, the little things you can do, like the breathing exercises we talked about, and I forgot to mention the Harmony bracelet, that's an inexpensive thing that can help so much in calming down the energy field in your body, which can help you feel better. So thank you for sharing about that, Lucia. Thank you so much.
Brenda says, thank you for the reasonable approach of base hits. I'm overwhelmed and anxious by maintaining all the lifestyle changes I've implemented since 2019. As soon as I eat sugar, dairy, nightshades, or gluten, likely grains in general, the muscle and joint pain and headaches return. Do you have any practical tips for maintaining cooking my own food and avoiding food to which I am sensitive as I recover from COVID and have little appetite for vegetables and meat?
Well, the first thing that comes up for me, I gave Marzi a gift about 8 months ago. and she thanks me regularly. It's called a Thermomix, and it comes from Germany. And this thing looks like a giant blender, but it cooks. I mean, she just cooked our dinner tonight, which was chicken meatballs with this great tomato-based gravy and mashed potatoes, all in one blender at one time. And it wasn't all blended together. There's different levels of it. And this thing is remarkable. You can like steam a whole fish and do vegetables and rice all in the same thing at the same time. It's really quite remarkable, but it's an investment. I think it was something like $1,600, but Marzi uses it quite regularly. She bakes with it. We grind our coffee beans. That's what I use it for, is to grind the coffee beans. I'm in charge of coffee. That's my contribution to our food here. But that's the first thing that I thought of, is finding the right tools so that you can make it easy to cook healthy foods for yourself. Michelle, do you want to add to that?
Yeah, an Instant Pot is a little bit less expensive, or a lot less expensive than that. And it's also great. It's like 8 tools in one. And usually Black Friday, they have it at a really discounted price on Amazon, but I'm sure you can find it many places. And it has a pressure cooker setting, but it's a great tool. And I really recommend batch cooking. So freezing things for when you don't feel up to cooking, or prepping like finger food. So all of the carrot sticks and jicama and cucumber, throw a unbleached paper towel in there to kind of absorb some of the water. Do that twice a week. You just really don't want that to sit for more than 4 days in the fridge, because it can start to grow LPS. But I'm really into batch cooking or prepping for a couple of days, because when I'm busy, I don't have time to cook from scratch every single meal. So that really helps me.
Those are great suggestions, really great suggestions. And I remember the old crock pots, that we used back in undergrad days. You throw a big hunk of meat in there and a bunch of potatoes, and open a can of tomatoes and throw it in there and a bunch of spices. Come home 8 hours later and it's really good, when you're gone all day. So batch cooking is a great idea, really great idea. Shanquila says, to avoid future cavitation, dental issues, is it better to have all wisdom teeth removed as teenager before roots form? I've never heard of that line of thinking being effective. I don't know. I wouldn't want to take out teeth unnecessarily. Michelle, do you have a different idea on that?
I've never heard that. I would really want to work with a holistic doctor who really understands cavitations. Right. So really choosing who you have pull the teeth, and just when they pull it out, cleaning it out with ozone can be really profound for not having those cavitation forms. So we really need a dentist on to talk us through this, but I would really talk to an expert in somebody who gets cavitations.
Agreed. Maggie King says, thank you, 70 years young, double exclamation points. Way to go, Maggie. Kathy says, I know this could be lots of things, but what about tingling the feet? We did that one.
Yeah, we're on Adriana. She says, hi, thank you for these. Once diagnosed with ulcers, what can we do as a healing approach to assist the healing? Waiting on biopsy results to see if H. pylori, clean eating, avoiding acidic foods, gluten and dairy-free, corn-free, marshmallow root is good to heal the gut, and using turmeric and colostrum.
Perfect, you're on the right path. I'd add applesauce in there. Freshly made applesauce to increase your intestinal alkaline phosphatase. It's an enzyme, arguably the most important enzyme in your gut that's produced in the gut. It does many, many things to protect your gut lining. I would also include bone broth. Because it contains gelatin tannate, which acts like a Band-Aid over a damaged gut, protecting it from everything that's moving by so that the cells can heal and not be being abrased by material that's flowing through the gut right now. So that's bone broth. That's one of the reasons why. And make sure it's organic, because a lot of bones out there have lead in them. So we want to make sure you're using organic for that. Let's see. The whole gut rebuilding protocol. You've already referenced colostrum, so that's excellent. Michelle, anything else you can think of?
Managing stress.
Breathe, yes.
Yeah.
Oh, and
I love that she's testing for H. pylori because that's so often the connection. And then if you have H. pylori, it's likely that everyone in the family does because it's highly contagious. So get everyone tested.
Right. Just spot, you know, if you eat a piece of bread and then you somebody takes a bite of your sandwich or your piece of gluten-free bread, they got H. pylori. Or if somebody takes a sip out of your glass of what you're drinking, that's all it takes because it's in the saliva and it can be on the glass that you just took a sip out of. It's easily transmissible, very easily. So make sure to check everybody in the family.
And it's why people often don't heal because they keep giving it back and forth to each other. So treating the whole family is important. Helen says, yes, anxiety. And can you advise how to help the elderly? My mother got a stroke after the AZ jab, could not talk, right soft with paralyzed. She was in the hospital for 8 weeks, now fully recovered, but at home. She phones me every day. She's in Australia. I'm in Asia. It is torture for me because I can't visit. I can't send remedies. What do I do? Her anxiety makes me hopeless and anxious. I exercise and live on an island, but how to help the elderly? Oh, really, kind of makes me teary.
Yeah, really good question. And I'm sorry that happened, but I'd send your mother the link to this Facebook Live. And just to start to get the big picture that anxiety is not a problem in your brain. Anxiety is an imbalance in your brain. It's not a problem with brain components. You know, it's not like the parts have gone bad, but rather the function of those parts are out of balance. For every one message, and this is Professor Michael Gershon at Princeton, who wrote the book, The Second Brain. And he told us, this was way back in 1999, for every one message from the brain going down telling the gut what to do, there are 9 messages from the gut going up telling the brain what to do. The ratio is 9 to 1. That's why you want a healthy microbiome. In dealing with anxiety, and it's one of the things I wanted to mention today, because we said we talk a little more about anxiety. In dealing with anxiety, you must focus on building a healthy, diverse microbiome. Critically important. And we've got a bunch of videos on how to do that. Today's talk is to introduce the idea to you. So you put a little time into learning, how do I rebuild a healthy microbiome? Michelle, do you want to add to that?
I think that's excellent. Yeah, I mean, gut health is so important. And we can easily overwhelm ourselves by trying to do it all at once. So I love your base hits approach, Dr. Tom. It's really important. Okay, this is someone who says, I totally got my thyroid back to normal levels, no medication. I lost 20 kilos and everything is normal. I realized the imbalance was trauma and stress. I hate that you had trauma and stress, but I love that you realized that connection. So important. I went through all this thyroid stuff with top doctors. It became poison. So I moved myself from those stresses, did more exercises, meditation, martial arts, and totally got strict on my diet. No gluten, no sugar, no dairy, only fresh vegetables, fish, meat, no pork. I feel 20. So this imbalance regarding thyroid is about rebalancing one's life mentally, emotionally, physically, and spiritually. So I had to remove myself from maintaining because to rebalance and let go, nothing I can do about my 81-year-old mother, but prayer work, sending love. We all have felt this stress and anxiety as a collective. Yes, to acknowledge and not deny, take action. Oh,
Amen.
that's beautiful.
That is beautiful. Really well said. And congratulations on your perseverance and continuing to put one foot in front of the other. That's the most important thing we can do, is just put one foot in front of the other. And thank you to the person earlier who commented on the Base Hits program. We just had Base Hits last night, and last night I was talking about the immune system. And for those of you who don't know, we'll put a link in here to the Base Hits program. You're welcome to join. It's a year-long program, and you can join whenever you want, and you've got access to all of the episodes that came earlier this year, and then of course the ones that are yet still to come. And I go into detail talking about whatever the topic is of the day, on basic principles, and then answer your questions in detail. Here on a Facebook Live, you know, we try to give you some ideas and some directions of where to go. In Base Hits, we dial it down. Do this, do this, do this, do this. As much as we can, not being your attending doctor, you know, so there's some limits as to how much we can say because we don't know your whole history. But Base Hits is, I have a lot of fun with Base Hits. It's very free flowing, and we'll put the link here so you can look at that if you so wish. Lucia asked the question, what can you tell us about muscular dystrophy? I have a friend who has it, and I'm sorry, that's one of those genetic conditions that I don't know. You can certainly help a person be more comfortable, and all of the concepts about food sensitivities and having a low inflammation lifestyle are critically important for their quality of life, but I don't know how to stop that one. I just don't know how.
Yeah, the genetics are tough. With so many genetic issues, you know, we can create a lifestyle where we can turn on or off the genes. I don't know enough about that one to weigh in.
Quincy says, hello, just a quick hello and thank you for these weekly lives. Thanks to my functional medicine doctor and you guys, I'm feeling so well. Way to go, Quincy. Glad to hear it. Glad to hear it. Priscilla is here from Waterloo. Jane says, I've started tracking my blood pressure and it's fluctuating wildly, normal to high. What might be causing this? Most likely, there is some anxiety or some type of internal stress going on that you might not even be aware of, that you're fine. I'm feeling fine. I'm handling my life really well right now. And if there's any of that kind of dynamic going on, that'll certainly cause it. But if there is no stress that you can identify, or anxiety or fluctuating anxiety, I'd look to your spine. I've had a number of patients over the years where their upper back and their neck were so far out of balance, it was causing these fluctuations in blood pressure and fluctuations in heart rate and arrhythmias. You know, I've had both types that have responded well. So high blood pressure is one thing, but fluctuating from normal to high and back and forth, there's a trigger that's setting that off. And you have to identify where is the trigger coming from that's setting that off. Michelle, do you want to add to that one?
I think you covered it. Great. Lori asked, why B12, Michelle? Isn't urinary methylmalonic acid plenty? If you have a urinary methylmalonic acid, that's great. Blood B12 is really inexpensive, and I just really like to see it above 700. I don't like to see it below 700. So it's just another way of looking at it, just to create more comprehensive information.
Maggie says, wow, studying for 5 years for healthy pregnancy. I'm meeting my new 2-week-old grandson next week. What can I give? Oh, that's interesting. Well, you know, it depends on where mom's at. I mean, the things that I really appreciated after the birth that turned out to be just wonderful. There's this thing called a haka. Michelle, do you know what a haka is?
No.
Okay. I'm going to excuse myself to get it for a minute. You continue what you're doing.
Okay, let's see here. Let's find another question. Is there a way to treat diverticulitis naturally without augmentin? My mother has stage 4 recurrent breast cancer and just today had a CT to confirm diverticulitis, and her GP is putting her on it for 10 days. So diverticulitis is these pockets in your colon, and it's often caused just from years and years of an unhealthy gut. So often with constipation, we can develop diverticulitis, and those little diverticuli store bacteria, and it can create flares that are really, really miserable. And so it's a comprehensive gut healing approach, I think, is the most important for diverticulitis. Sometimes you can do like a colonic to get some immediate relief because it can go in and wash out some of that bacteria, but ultimately to heal those pockets in the gut, it takes a comprehensive 6R program, 4R, 5 R's. I think it's now 6R approach to healing the gut.
Okay,
let's see it. What is it?
Back to it. So this is a haka. It's made of silicone. And what happens when Marzi would be breastfeeding with Geo on her left breast, as an example, you squeeze this and you put it on the right breast and let it go. It creates a suction and it sits there like this, and it causes the right breast to drip milk. So Marzi's feeding Geo on this side, and we would collect maybe this much in every feeding, put it into a silicone bag in the refrigerator, and at the end of the day, we would date it and put it in the freezer. And there are so many benefits to this. The first thing is that women who use hakas have a much lower incidence of mastitis, which is an infection that develops from breastfeeding. Why? Because there's still milk in there and it starts to dry up, and the canals for the fluid to flow start getting restricted because there's dried up milk in there because baby didn't suck it all out. And so this is draining a little of the unsuckled breast. And then 3 hours later, whatever it is, Geo is feeding on the other side, and Marzi was using the haka on the opposite side. And so we had, well, let's see, we're at 10 months now. So for the first 8 months, so that's 240 bags of frozen breast milk that we were able to give to mothers who were unable to breastfeed for one reason or another. So these newborn babies and these young infants were getting the very best food in the world because Marzi did years of detoxing before pregnancy, and she eats organic, everything's organic, plus she gets my coffee in the morning. Well, I make the coffee for her, which is loaded with good fat. So her milk is just abundanza, and which is one reason why Geo is so healthy and vibrant, right? So we produced about 200 plus bags of frozen milk, high quality milk. And we just saw a couple last week who we had given 30 or 40 bags to, and the mom just about started crying in gratitude because her baby just stabilized and got healthier every day and had more energy and more engagement with mom and dad and wasn't having to get formula. Hakas, H-A-K-K-A. I thought that what a wonderful invention, you know, that it not only saved Marzi from having any complications with breastfeeding, but we were able to share the wealth with a few families. So I hope that helps Grandma in thinking about if your daughter or daughter-in-law is breastfeeding, that's a wonderful little tool that you can get.
Should we do one more?
Sure.
Okay, Terry says, my recent NeuralZoomer Plus showed markers for Guillain-Barré and MS. News to me. Could this be either from the shingles or COVID vaccines?
Yes and yes. So did the NeuralZoomer Plus also show herpes? If it did, then most likely there may be that correlation. But we're seeing now from the vaccines that when you receive the vaccine, the goal is to stimulate your immune system to make antibodies to the protein in that vaccine. It's called the spike protein. And what Professor Schoenfeld, the godfather of autoimmunity, has now published is that the antibodies to the spike protein of the vaccine, those antibodies cross-react with 27 different tissues in the female reproductive system, meaning those antibodies can trigger an autoimmune mechanism in the young woman who received the vaccine, which may affect her fertility or her ability to have a successful pregnancy. You know, for example, when an egg is fertilized by sperm, it triggers a gene to make the protein so that fertilized egg can grab onto the wall of the uterus. That protein, the antibodies to the spike protein can attack that protein where the fertilized egg is supposed to bind onto the uterine wall. 27 different proteins, and that's just one of them. So we're seeing all kinds of complications that are now showing up from these unapproved, untested vaccines that have been forced on the vast majority of the population. We don't know what's going to happen, what else is going to happen. But it's great that you have the baseline test. You know there's a problem now. Now you can start working on it. Now you can look to see where is the inflammation coming from in my body that's triggering these markers for Guillain-Barré, and what was the other one that she said?
And MS. Arrest the development, right, Dr. Tom? These tests are not diagnostic. Doesn't mean you're going to get Guillain-Barré or MS. Right. It means you may have a vulnerability to head down that road. So slam on the brakes, turn the car around, or just get off the road entirely.
Right, exactly.
Functional medicine approach of like whole body healing.
It's like if you have a blood test and it says your cholesterol is a little high, it doesn't mean you're getting a heart attack. You know, it means your cholesterol is a little high. Let's see what we can do to bring it down if it's a little too high. But if you have these elevated antibodies to your brain tissue, it doesn't mean you're getting MS, but it means you're heading down that direction. And so as Michelle said, put on the brakes. Let's figure out what needs to be done. It's going to take 3 to 6 months. Don't do the test again after you've implemented protocols for at least 6 months so that there's enough time to get to kind of turn that car around.
Mm-hmm. And MS, one of the keys is getting the BPA out. So not drinking out of plastic water bottles, being really careful with the receipts that are all coded, and just do a Google search or a DuckDuckGo search for everywhere BPA can be found in the environment and really minimize your exposure. So as Dr. Tom said earlier, not storing in plastic containers, you know, all these plastic bags in our kitchens, right? It can be challenging to move away from the plastic, but really worth it.
For those that don't know, BPA is bisphenol A. It's a chemical used to mold plastic, and it grabs onto the tissue in our body. You know, you drink water from a plastic bottle, you're getting BPA. You put nail polish on, unless you buy organic phthalate-free nail polish, you're getting BPA in your bloodstream. There's so many sources now of it, and these minute amounts of BPA can grab onto your tissue, like your thyroid, very common on thyroid. Just Google BPA and thyroid, you see the studies. Then your immune system says, what's that? That's not a thyroid cell, that's a thyroid BPA. whatever a thyroBPA is. Doesn't know what it is. So the immune system makes antibodies to attack that thyroBPA, which is, it's called a neoepitope, a new combination that's not known by the immune system. And when you make antibodies to the neoepitope, the thyroBPA, you're damaging the thyroid cell that's still there, but now it's covered with BPA. And when you damage the thyroid cell, now you make more antibodies to the thyroid to get rid of the old and damaged cells. But you keep drinking water out of plastic bottles because spring water is healthier for you than tap water, so you thought. And so you keep drinking and you get more BPA, and your genetic vulnerability is that it grabs onto your nerves, the myelin on your nerves. You keep making more antibodies to the MyelBPA instead of the thyroBPA. It just depends on what your genetic vulnerability is as to where the BPA accumulates. So as Michelle's saying, you have to reduce your exposure to all of these plasticizers. There was an article that came out about 3 weeks ago that showed microplastics. The amount of microplastics we're exposed to now is terribly high, somewhere between 1 to 5 grams a day. People are being exposed to. That's like the size of a credit card of microplastic that we're being exposed to, and it gets into our brains, it gets into our heart muscle, it gets into our thyroid. We're moving more in the direction of live simply. Just be as simple as you can in your food selections and in your environmental exposures as much as possible. You can't eliminate everything, but you can certainly reduce your exposures substantially. Michelle, anything to add to that?
I just completely agree. I think it's so important, and be wary of the BPA-free plastic because we don't know if it's more dangerous than the BPA.
Actually, we do. It's BPS, and it is more dangerous. There's just not hundreds of studies yet, so the public hasn't really learned about it. But it's BPS. When they say BPA-free, good point you bring it up. It's because they're using BPS, and it's more toxic. It stimulates more of an immune response than BPA does.
And on that note, we need another hit of Geo before we go. That's
right. Unfortunately, he's asleep now. He's asleep. So very sorry, for all of that. But these sessions, these are about learning base hits, learning the little things that you can do on an ongoing basis, one more thing, and then the next thing, and then the next thing. It becomes a way of life of how do you protect yourself and your family. And that's the only way that we know of surviving and thriving in this crazy world that we're in right now.
Mm-hmm. Yeah. Thanks everyone for joining us, for being here. It means the world.
It does. It does. Thank you all so very much. Thank you, Michelle.
Thanks, Dr. Tom.
Yes. And we'll see you next week, folks. Good night.